Hello everyone, my name is Erica Croswhite and I will be presenting on the ethics of managing confidentiality with minor clients. The problem statement is that there is ethical tension that exists between parental rights, therapeutic trust and alliance, and the adolescent or the minor client's autonomy. The harm that potentially exists with these ethical dilemmas they are related to breached therapeutic alliance between the therapist and the client. There can be a safety risk from overprotecting the client. There can be legal and licensure concerns, and there are risks related to the client's identity and autonomy. So, Bettis et al. Talked about how minor clients may self-censor when they believe that parents can access information discussed in therapy in a study that they conducted in 2023. Another aspect of this is that if the therapist withholds information about suicide ideation, self-harm, intent to harm someone else, or abuse or neglect, that can place the minor in a life-threatening situation, which is related to being a mandated reporter. Another area of potential harm is that there could be a risk related to violating parental rights that could result in civil liability against the therapist, but over-disclosing may violate HIPAA or state laws and other ethical codes, which either one of those cases could result in your license being suspended or eliminated, actually. And then another area of harm is that confidentiality breaches can be physically and psychologically dangerous if the client's home is not a safe space and the therapist has disclosed something to the family, which then puts the client at risk when they go home. The ACA Code of Ethics has several principles related to this topic. Number one is that if a minor is unable to give consent, the counselor must seek voluntary agreement to services and include them in decision making in a developmentally appropriate way. So they have to receive consent somehow. They also must uphold the respect for confidentiality and only disclose information that's appropriate with consent or that is legally or ethically justified. Counselors must also inform clients about the limitations of confidentiality and identify situations when it must be breached and tell the client when that's the case. Counselors are also explicitly required to protect the confidentiality of the information received as specified by the federal and state laws, written policies, and ethical standards. And then related to parents and guardians, parents are notified of confidentiality practices in the counseling relationship as well, and cultural sensitivity is upheld within the family system as much as possible. Counselors are to respect the parent and guardian rights, and a collaborative relationship is the number one goal. That's the priority between minor clients, parents, and therapists whenever possible. If a therapist needs to release confidential information, they must do so by only when minor clients can give consent. But if they cannot give consent for whatever reason, then they must seek permission from an outside appropriate third party, which is often the parents, to disclose the information. And in that situation, counselors still advocate for what the minor is comfortable sharing and what they understand that is shared. According to the National Board for Certified Counselors, there are several principles related to this topic as well. So again, counselors can only solicit pertinent information from the client, minor or adult, that's related to counseling goals. The counselors must not share client information without specific written consent, except when necessary to prevent serious and foreseeable harm, just as the ACA Code of Ethics requires. Also, counselors shall obtain informed consent prior to providing services. And counselors protect the confidentiality of information received in counseling with minors according to federal and state laws, policies, and ethical standards. Counselors must also respect the inherent and legal rights of parents and guardians, and they shall collaborate with parents and guardians. And counselors need to consider custody agreements and work with both parents in those situations whenever possible. So the ACA and the NBCC Code of Ethics related to this topic are very similar. In the state of Colorado, where I live, there are several statutes that are related to this topic, and they are specific according to age. So first, parents and guardians hold all legal rights to consent for minors under the age of 12. But once a child is 12 or older, they are able to consent to psychotherapy services without their parents' consent or without notifying their parents for outpatient treatment. But the minor must sign a statement indicating that they are voluntarily seeking services, and the counselor must assess that the minor is capable of engaging in the therapeutic process. Counselors must also discuss the importance of involving parents with the minor client and encourage minors to involve their parents. And most importantly, document that they had these conversations with the minor, what was said, what was encouraged, and what was the minor's response. When minors reach the age of 15 in the state of Colorado, they can consent to voluntary inpatient psychiatric hospitalization or behavioral health services involving medications without parental consent. Again, the therapist should teach the minor about the importance of just involving parents as much as possible or when appropriate, and also must make sure that the client is seeking voluntary services and that they are capable of engaging in those services. Colorado law, same as the Code of Ethics, overrides a minor's right to confidentiality if the minor discloses suicide ideation or threat or harm to others, or if they are experiencing abuse or neglect. And then another statute protects the patient-therapist privilege about the client's communication within sessions from being disclosed in a court without consent. And related to minors, parents and guardians hold the legal right to waive the therapist-patient privilege, but they may not waive that privilege if their waiver is self-serving. So the hypothetical scenario is about a patient or client whose name is Ariana Salazar. She's 15. She's referred to family counseling after a conflict with her parents. In an individual session, she disclosed that she's questioning her sexual orientation, and she's communicating with an online LGBTQ+ support group. She's not suicidal or in danger, but she begs her counselor not to tell her parents, describing them as being very traditional. Her father then calls the counselor, demanding a full summary of what Ariana has discussed in the sessions, citing his parental rights. So the therapist can look at this from a few different perspectives. First, legally in the state of Colorado, Ariana is old enough to consent for her own treatment under Colorado state law because she's 15. Second, there is no imminent danger. She's not suicidal or at risk for harming others, and she's not disclosed abuse or neglect. But there are competing rights. Ariana's dad has general parental rights, and the counselor must respect those rights as a parent. But Ariana has privacy rights backed by Colorado law and the ACA and NBCC ethical codes to maintain confidentiality. So there are two possible solutions, probably more. One solution could be a facilitated disclosure. So the counselor could talk to Ariana about her father's request in the next session and kind of encourage Ariana to consider sharing some of the information with her father, depending on what she's comfortable. And then the counselor could facilitate a family session where Ariana discloses what she wants to share with her dad, which keeps the family system engaged and empowers Ariana. But Ariana could feel pressure to disclose something that might break the therapeutic alliance between she and the counselor. It all depends. Another solution could be that the counselor could inform Ariana's father that she's engaged in making progress in therapy, but under the Colorado law and the Code of Ethics, the session content cannot be shared without her consent. The counselor could invite the father to attend a joint session with Ariana if that's what she wants. And in both of these scenarios, the calls and the sessions and the notes all need to be documented well. If the therapist maintained confidentiality and went with solution number 2, that would protect the therapeutic alliance while upholding the law, but Ariana's father could withdraw her from counseling or refuse to pay for future sessions. So there's always pros and cons to these ethical dilemmas. The key takeaways here are: always talk with the minor clients about the privacy and confidentiality rights in a developmentally appropriate manner based on their age, and you need to know the law, the ethical codes. You have to use professional discretion. It's also good to consult with your colleagues when necessary. Thirdly, documenting everything that happens in the sessions, in the calls, the rationale behind your decisions, and constantly being prepared to be subpoenaed at any time, so making sure your documentation is thorough. And then lastly, the minor's safety is the top priority in all of these circumstances. Here are my references. Thanks, everyone.